Awesome. We will go ahead and get started. Hello again to everyone, and welcome to Critical Path Institute's Rare and Orphan Disease Program webinar series today. My name is Dominique Cruz, and I'm a project manager for the Rare Disease Cures Accelerator Data and Analytics Platform, or RDCA-DAP for short. RDCA-DAP provides a centralized and standardized infrastructure to support and speed up rare disease characterization with the goal of accelerating therapy development for rare diseases. It's my pleasure to welcome everyone to today's webinars, Vivli and RDCA-DAP, data platform partnerships to promote rare disease data sharing. Before we begin, I'd like to go over a few housekeeping items. If you have any questions throughout the presentation for our speaker or our panelists, please put them in the Q&A chat box. The chat function is disabled for everyone, so we can make sure that we don't miss any questions that come up, and all participant lines are muted so that we can reduce background noise. We are recording this presentation and it will be available for on-demand viewing on our YouTube channel after the presentation. So we will start with a presentation from Julie Wood and end with a discussion and Q&A with a group of expert panelists. So just to introduce our speaker, Julie Wood, she is the Chief Operating Officer at Vivli, who's responsible for operations, including supporting members and researchers with data archiving, access, and analysis on the Vivli platform. And with that, I will hand it over to Julie.
Great, thank you. It's very nice to be here, and I'm delighted to talk about this work that we have been doing. Vivli and Critical Path have been working together on for many, many years. And this is really kind of the first public outing of this partnership beyond kind of on press releases and whatnot. So thank you so much for having me today. If you go to the next slide, what I really want to talk about and kind of will share with you is I'm going to talk very briefly about Vivli and who we are and what we do. Then I'm going to talk about the partnership that we have formed with Critical Path and I've had since the very beginning of Vivli, since it started. I'm going to talk about the process that we have developed to really try to work together to facilitate access to rare disease data. And with that, I'll use a case study. So how we've worked, Critical Path, Vivli, and Biogen have worked together to really share that rare disease data. So please do ask questions. I'm going to talk through kind of at a broad level what we're doing, and then we can kind of get into it when we get into the discussion and the Q&A. So just to introduce Vivli, and if you advance it, there you go, thank you. Vivli, we're a nonprofit organization. We started out of Harvard about 7 years ago. We were started from a project at the MRCT that is part of Harvard and Brigham and Women's Hospital. And then we formed our own nonprofit organization to really focus on data sharing. So our entire mission is to focus on sharing data from completed clinical research. And who we work all across the community to share with, to make sharing as easy as possible for industry, academia, nonprofit funders, foundations, government, and also working with patient and patient advocacy groups. One of the key ways we do that is by being as harmonized as possible where it makes the most sense, where we can be as efficient as possible in our legal agreements and in the way that we work, but trying to retain some flexibility to meet all the needs of the wider community. And the key way that we do that is through the Vivli platform. So we work through the Vivli platform as a very secure way to share data and make that accessible and an efficient process. So if you go to the next slide, I'll just kind of give you some highlights of Vivli kind of by the numbers as it stands today. There's over 7,500 clinical trials that are currently available in Vivli for requesting and sharing on our platform today. That is data from over 55 members. And from the requests that we have received to date, we already have 350 public disclosures. So publications, conference abstracts, learned forums is what we consider to be a public disclosure from the data that is shared through Vivli and through that request process. From those public disclosures, we already have over 1,200 citations So really trying to drive forward the science and the scientific literature by taking the data from those completed clinical trials and trying to unlock that beyond just the first original use, but to really move forward that secondary analysis from this very rich data sets that can be found. If you go to the next slide, this is the list of industry members who work with Vivli currently, and how we work with them to try to help our industry members meet their FPIA and pharma data sharing commitments. You know, there are industry commitments to share their data from completed clinical trials for those approved products. If you go to the next slide. And then we also have our other parts of the community that we work with. So we work with many academic organizations. I mentioned Harvard earlier, UCLA, Stanford, UCSF. They all work with Vivli to meet the data sharing commitments of government funders and foundations that they work with, particularly the NIH. The NIH rolled out a data sharing policy a couple of years ago. So they're trying to help their researchers meet those kind of commitments that from their grantees. We also work with foundations such as the Bill and Melinda Gates Foundation and others for their grantees to make it easy for them to also meet those kind of open science data sharing commitments. And then that leads me on to some of the other data sharing organizations. If you go back one, the other data sharing organizations that we work with, including Critical Path. So Critical Path was a founding member of Vivli. So when Vivli was launched, Critical Path has worked with us to support our work since the absolute beginning, and we're very grateful to that partnership and support that we have received with them from Critical Path. So if you go to the next slide, I'll talk about our partnership and what we have done. So I think this was about 4 years ago, we started talking about the work that Critical Path was going to do with rare disease data sharing. And at that time, we worked very closely with the Critical Path team to think about how could we use Vivli as a way to make it easier for the Critical Path team to access data. So as you all know, Critical Path works in so many key therapeutic areas. It made a lot of sense for Critical Path to work with Vivli, with all of our members, to find a way to access that data more efficiently than necessarily having to go to each member to ask for each study, but trying to think about how could we work together to make it easier to access this data and get it to be shared and used. And so earlier this year, we announced our partnership, and I'm going to talk about that case study a little bit in a little bit. So if you go to the next slide. So what were the reasons why we worked together? So there's a lot of synergy, and I really think the best partnerships work when both sides get their needs met. So I talked through some of the ways that Vivli works. So we have a data sharing partnership. We have 55 members, many of those from industry, who also work with Critical Path and know Critical Path very well. We have this harmonized legal agreement process. So we have a standard data use agreement that all of our members agree to, which makes it much easier to access data when it's all under one harmonized agreement. We also, from the platform, have an efficient data request process and review process. And we have a team that helps kind of usher those requests through that process. That efficient data request process means that we have one data request form. No matter how many studies you're requesting on the Vivli platform, you only fill out one request, and then you can you add in all the studies into that one request, which makes it much easier for researchers to request data. But where we were working and finding and had many discussions with our members is that they had a desire to share more rare disease data, but many of them were unable to share rare disease data because of the risks of re-identification. So Vivli only accepts anonymized data, and those risks of re-identification, because the trials were smaller, because it was rare disease data, meant that many times they were unable to share rare disease data, or if they could share it, the utility was very low because there'd been so much done to anonymize and protect patients' privacy that the data did not have the utility that anyone desired. So those were some of the, those were some of the pros and things that are good about Vivli. And then, we were trying to support our members and think about ways that we could help them with their rare disease data sharing. And that's really where the critical path RDCA-DAP came in. And if you move forward, we had many conversations about working with Critical Path. They've been a partner since we formed, and as a trusted entity across so many data sharing consortiums, it really lended itself to thinking about how we could work more closely with the need that we had to want to share more rare disease data, but struggling to get our members to do that because of these concerns. So we formed this partnership. And in addition, because of this known entity of Critical Path that many of our members already worked with, they were on these consortiums anyway. And then RDCA-DAP and the work that Critical Path does to aggregate and harmonize rare disease data, we thought maybe allowed for a way forward to share data, but also protect patient privacy. And then because RDCA-DAP is going to be working with a rare disease community to share this data, to reach out to them, in ways that really Vivli, as a very small nonprofit across 28 therapeutic areas, just was not going to be able to do. So to be able to then work together to reach out, to let people know this data is available, to have it be harmonized and have it be aggregated so it'd be easier for researchers to access. This really seemed like an efficient partnership where both sides would really be able to leverage those learnings and be able to kind of work together to have the sum be greater than the parts. We go to the next slide. So what's the process for facilitating access to the rare disease data? And I'll try to step you through this. It can get a little complicated. So if you have questions, please do put them in the chat and we'll come back to them. We created a 3-step process to try to make rare disease data access as easy as possible, and to really think about how we do that. So I'll just talk through these steps at a high level, and then each slide kind of breaks out the kind of sub-steps and the subtasks underneath that. So the first step is that the Critical Path team requests the rare disease data from Vivli using the Vivli request process. Then once it's approved, the RDCA-DAP team harmonizes that data. And then put it very simply, the harmonized data is requested. So if you go to the next slide, so in terms of that first step, that request process for the rare disease data, so you can go into our platform and you can search for data that's available. If you can also put in inquiries. So if there's data that maybe isn't listed, but a member would be willing to share with Critical Path, we have a process to allow the Critical Path team to ask those questions at a very high level to make it easier to see if a member is willing to share that rare disease data. And then it goes into the request. So then the Critical Path team only needs to submit one request, no matter how many data sets they are asking for. So you just put in one request, and then each member will review those, and they have publicly stated policies for how those requests are reviewed. And then if it's approved, the data has been allowed to be downloaded from Vivli, and it's loaded into our RDCA-DAP secure research environment for access and analysis. Why were our members so interested in this? Why was this helpful? One, it makes it much easier because many of our members have a centralized process. They have teams that all they do is manage these data requests across, the hundreds of studies that are available. And so it makes it much easier for them to have one place, that's Vivli, to understand what's going on with all their data sharing, or to try to consolidate that as much as they can. So that was very attractive to our members. Also, that this all could be done through our standard Vivli legal agreements. So they didn't have to negotiate new agreements. Everything could be clearly done within a standard legal agreement. And we worked very closely with the RDCA-DAP team to look at their legal agreement to make sure everything was aligned to, again, also streamline this and make it as easy as possible for our members to agree. And then the data is also available for download by Critical Path, but it can only be downloaded to go into that secure research environment. So again, it creates that kind of a secure, managed way for the data to move around. So if we go to the next slide, so that's kind of the first step. So getting the Critical Path team to actually get the data. And then that next step, and I'm sure the Critical Path team can talk about this much more eloquently than I can in terms of what they've done to harmonize and curate the data. When they put in their request, they do have to Vivli, you have one of the key requirements is that you need to publish your results. So the RDCA-DAP has a research project and they share that public disclosure once everything's harmonized. And then when the research is completed, that harmonized data set the metadata is put on Vivli so that we're trying to raise awareness. We're doing what we can to make sure that people see that data there's a harmonized data set that can be accessed, and that RDCA-DAP also makes that available to the rare disease community on their platform. We go to the next slide. And then, so regardless, the data, either it's the metadata, so the kind of outlines of that data are on Vivli, we would redirect a researcher when they click on that study to say, go request this data through RDCA-DAP and submit a data request. So once that data request is submitted through RDCA-DAP, they may, look at the RDCA-DAP platform, include any data sets that meet their search criteria in that request. That may include the Biogen data, which we'll be talking about in the case study next. And then the decision of where that data, how that data gets shared, if it gets approved, that can either be done by the RDCA-DAP Data Use Committee, or the sponsor can review that request via RDCA-DAP. Where Vivli comes in is that the RDCA-DAP would inform us about the request. So we make sure that our members also know, hey, you've shared this harmonized data set. Your studies have contributed to that. And this is also another way that you can advance science. And if there's further publications from those additional secondary analysis or additional requests, that would be included and be something we would promote as well on our website. Go to the next slide. So I just wanted to my last closing piece of information is to talk about a real life case study. So we really wanted to talk about this partnership when we had a case study and could share in real life what is happening. And I'm delighted to talk about the work that we have done with Biogen on their progressive supranuclear palsy data by sharing that data with Critical Path through this Vivli process. So Biogen, they have a long history of data sharing, and they really wanted to do more to share this anonymized rare disease data. And so they agreed to, as a first step, to share this PSP data with Critical Path. That data was then harmonized, and it was with other data in RDCA-DAP, and it can be accessed through the platform. And I'm delighted to say that there have already been at least one, if not two, data requests for that harmonized placebo data set on through RDCA-DAP from this process. So I think we're really seeing how a harmonized data set on the right platform where a community has already congregated around a therapeutic area make much more sense for that data to be used and really to be able to unlock the benefits of this data by making it harmonized, by making it available through RDCA-DAP. And we look forward to having more requests come through and subsequent publications as well for this data to be used. You go to the next slide. This just shows if you go to our website, you can look up this page. It talks through exactly, we've made it publicly available, exactly how this data was going to be used, how it could be leveraged and maximized by the RDCA-DAP team to continue to move forward the work. And you can see that all on the website. And that was part of our commitment to transparency to how data is being shared. So this is what it looks like when it's public and approved. Go to the next slide. You can see this is what it looks like on the Vivli platform in terms of if a researcher finds this on Vivli, they would find kind of this key, there'd be key information. So there's information about the study details. It lists information about kind of usage, how many people have looked at this, how many have downloaded it, how many people have requested it. It provides administrative details as well, kind of anything we could possibly share upfront to help a researcher that's available. It's on the Vivli platform. If someone clicks on this and adds it to a request, it would take them to Critical Path where they could move forward and continue with their request over there. Go to the next slide. So, I just really, in summary, I think this partnership, it's a great example of really helping everyone with data sharing and really getting to what we all have been working towards. So, this slide is really about all the stakeholders who were involved in the case study that I just walked you through. So, researchers, making it easy for them to quickly access the centralized, anonymized, harmonized, high quality data sets, but also reducing the bureaucracy. Researchers don't want to necessarily fill out data request forms or legal agreements or walk through all the, the steps that it does take to access these data sets in a way that, protects patients. So we've really tried to keep this as efficient and centralized as possible to reduce that, because researchers want to get on with the science. And so that's what we're trying to facilitate with this. We were just so delighted to have Biogen kind of share their commitment and really to be the first to say, I want to share our rare disease data sets in this way, because we think this will be more efficient for us. But also we can feel confident in protecting patients' privacy, but also, again, get this data out there so that they can kind of contribute to the science around these diseases and hopefully lead to greater insight. For the Vivli team, our members like it. It's a much more streamlined way to do it, but also fits with our mission of really advancing data sharing. And by working with by working with Critical Path, kind of a known partner in this space, and we can just continue to move forward these partnerships to really, with the hope that you're going to see more advances in these rare diseases to lead to more drug development in rare disease. But at the heart of all of this, we're really trying to honor those commitments of patients, of participants in clinical trials who we know, patients with rare diseases, their loved ones and caregivers really want to see the data unlocked. They want to see the data be used. And so we've tried to strike a balance to make sure that the commitment to patients' privacy is met, but also that this data is shared and utilized to really meet those commitments. So that's the end of my presentation. And if you want to reach out to me directly and you have any questions or comments, feel free to do that. So look forward to continue with the webinar and the discussion.
Thank you so much, Julie, for this great presentation. So welcome, or good morning, everyone. I'm Alexandre Betourne. I'm Executive Director for the RDCA-DAP. I want to introduce my colleagues joining us for the panel discussion today. Dr. Ramona Walls, she's Executive Director of Data Science for our Data Collaboration Center. I'm sure you've seen Ramona on a couple of our previous presentations and webinar and discussion with RDCA-DAP. She's really at the core of implementing innovation for the platform and also in the way data can be explored on the RDCA-DAP platform and analyzed. Joining us today as well, Rick Liwski. Actually, Rick, I don't think I've ever pronounced your name in public, so apologies. I'm just realizing I'm not sure it's the right pronunciation, so feel free to correct me.
No, that's fine.
That's fine. Okay. Rick is our Chief Technology Officer. You may not have seen him as often if you follow RDCA-DAP, but Rick really has been following and helping and developing the platform with us. A great source of information for me as I joined the team late 2020. lots of complex discussions surrounding implementation of the governance, but also the legal and the security of the platform, which really was a great source of information and a lot of good interactions as we work together on this project. So to remind our audience, we have a Q&A tab, so please do send your questions and we will start addressing these. But maybe just to open up the discussions, Julie had a follow-up on the presentation. We were both, extremely excited when we finally built that bridge between Vivli and RDCA-DAP. But can you tell us a bit more? Why was it such a good news, and how is it a good news for rare disease research? And also, how do you see a partnership like that improving access and use and reuse of rare disease data?
Sure. So, I mean, I think this was such good news because when we started Vivli, we knew we could see that many of our members were just unable to share rare disease data. It's just an exception for many of their policies. And I'm really talking about industry members who, they're sharing hundreds, if not thousands of data sets. And they would just say, we're not sharing rare disease data set because of these anonymization issues. So, and we did a hackathon, we did webinars, we were trying to do everything we possibly could to try to unlock this. And I think this is the first time where we really have come up with a solution that has solved the concerns of many of our members with those anonymization issues. So they were so worried about protecting patient privacy, they just didn't feel that they could share that data in a way that had the integrity that was needed. And would have the utility really to be able to share. And I think that's the big difference with the critical path approach, because you're collecting data from other sources than just Vivli. So you're going to have greater power in the data sets that have been collected. And so I think members felt that they would be able to share that data through this partnership in ways that they couldn't otherwise do so. So, I mean, does that answer your question? I think you had a lot of other things I might have.
Yeah, no, that answered the question. Maybe you, Ramona or Rick. I mean, just, more broadly, like, why is it so important? Like, why is it great news? But maybe like Rick or Ramona, what's your perspective on this new collaboration and this new bridge that we opened with the Vivli platform?
Well, I can go for it. So I really think it's critically important and mutually beneficial that for organizations like C-Path and Vivli to work together and make it easier and more efficient for researchers to get access to and utilize the data that they need to facilitate their research. So ultimately, both Vivli and RDCA-DAP are trying to drive innovation and accelerate the development of new treatments for rare disease patients, and to really stand behind that mission. I think we have to break down the barriers that stand in the way. And one of the big barriers is just finding the data you need and then being able to access it without going through tons of gyrations to be able to get it into a format that you need to do your research and in an environment with tools that you need to perform that research. I also think the notion of having all useful data that a researcher might need to achieve their research goals available in one single, easy to use monolithic platform is just no longer realistic. And it's imperative that data platforms like Vivli and RDCA-DAP and others make it as easy as possible for those researchers to find that data and access it. And that requires us to work together. We have to build APIs and processes to shield the users from those complexities of having to search across multiple databases, submit multiple access requests and analysis plans, and then assuming they do get all the approvals they need, trying to wrangle all that data from multiple sources into and try to make sense of it. So I hope that, and I believe that by working together and demonstrating the benefits of this collaboration, it'll encourage other platform providers and data contributors to follow suit.
Yeah, I would have said exactly what Rick said. And so it's really about this need to build an ecosystem rather than what we've had for the past 10 years, which is a group of isolated and dispersed data resources. Now we're really starting to have the technical capabilities and finally overcoming those social social hurdles to be able to build this unified ecosystem, which is so important for rare disease patients.
Yeah, and we had, lots of conversation about this recently. The reality is that platforms continues to be built, even if they're not there yet. Grants are being applied to build new data platforms. And so the way RDCA-DAP was conceived was to break silos in data sharing, but the silos keep on being created. And so we really need to, that's why it's really important for me to tell the world, hey, we been discussing with Vivli, we are collaborating, we built a bridge to have two platforms that don't compete, but actually, collaborate to a mutual benefit, but also a benefit to patients because it's making the data more visible, more accessible with different reasons to access the data on Vivli versus RDCA-DAP. We have differences, but in the end, that's the mutual benefit that we have here. And we are never going to get a unified database with all the rare disease data in the world, which, was the ideal of the RDCA-DAP platform. But what we can do is this kind of collaboration and just fostering that ecosystem where we build these bridges, and we were working with other data platforms in the rare disease space to try to really continue to build additional bridges. So to me, that's really critical. Ramona, maybe can you comment on what do you see a benefit from a user perspective to get access to the data on RDCA-DAP instead of going through Vivli, meaning using that bridge that we have to get the Vivli data on RDCA-DAP? What's the difference and some of the added value?
Yeah, I mean, so both platforms offer access to data and access to a computational environment, a secure environment where you can analyze the data. But again, they're different data sources. So the big advantage is being able to bring together data from multiple sources. So data from Vivli, which is coming from clinical trials, the rich data sets that we have in C-Path that are coming from patient organizations or non clinical trial sources, even for a few diseases now, electronic health records or other real world data coming in. And so that ability to bring together many different types of data sources and analyze them in a secure environment. And you can also then bring your own data into a workspace on RDCA-DAP and do additional analyses as well. And of course, there's the real added value that we offer at C-Path, which is the curation and standardization of data from multiple sources, right? So not having to go in and solve that the challenge of, there are 6 different ways of representing sex in 6 different data sets. Like even a really simple variable like the sex of the patient can be really unharmonious, right? And so we take care of that harmonization beforehand. That makes it a lot richer and easier for the patient. A third benefit that I would add is that for particular disease areas in rare diseases, we are also now enriching data with ontologies. We have a pipeline that automatically annotates the disease area and the phenotypes with open public ontologies, and that connects them to other linked data for all of the annotations that are publicly available for those diseases. So disease to gene, phenotype to gene, gene to disease to phenotype, etc. So that information is available to aid in discovery, link out, and enrich your analyses as well through RDCA-DAP.
Anything to add, Rick, on that? Or?
Yeah, no, I was going to mention that one of the big things that we do with the RDCA-DAP is to try to curate the data for specific research purposes, to try to make it easier for researchers to make use of that data as quickly as possible so they don't have to perform that data wrangling. And Ramona alluded to that or discussed that in her response.
Thanks, Rick. And as Ramona said, so there is a piece of one may now, request the PSP data set, and there's data on RDCA-DAP that is not on Vivli. But it's a mutual, it's a mutual benefit. So Judy, you list the metadata on Vivli. We haven't gone to that yet, but part of our commitment is that if one wants to request access on Vivli to the standardized data set, but wants it on Vivli because Vivli has data that we don't have, then we may we are able to provide the standardized data sets for them to use on the Vivi platform with the rest of the data. So there is a, the conversation goes both way, and with different data sets that one may access on different platforms. I think that's part of the benefits of the collaboration as well. I'm not seeing many questions from the audience. So
Alex, I see there's actually a couple of questions that have been copied over the chat. The first one being about aggregation and anonymization. And so the person is asking is, what is the impact of the aggregation on anonymization of the data package by the original data owner? Does it allow for anonymization with a higher risk, providing it will be aggregated later? And does the anonymized data alone, where the anonymized data would not be shared, you can share these aggregated data sets? Julie or Rick, do you guys want to address that, or want me to address it?
Yeah, I can talk a little bit about it. So there certainly is, I mean, that's always the trade-off is the more anonymization that's performed, that can decrease the utility of the data. And the idea behind, we always get de-identified data, but with rare disease data, that always raises the risk of identification if it can be linked with other data. So we have protocols that if there's, not enough data, or if there's not enough patients under a certain variable, it has to be aggregated with more data sets until you reach a certain threshold. And then we've gone through an evaluation by an external source. There's never zero risk of re-identification, but we try to achieve as small a risk of re-identification, and then we cover the rest of that especially under GDPR, with making sure we have the right standard contractual clauses in place with the data provider, that either they have consent or the data is anonymized to a point where it's not required. And then we, of course, have DUAs and review every analysis plan that gets submitted to make sure that the research the person's performing won't lead to re-identification. And then they have to sign a very explicit DUA that says they won't attempt to re-identify the data. And then we have the audit controls in place to make sure that they don't do that.
Yeah.
Judy, yes.
Go ahead, Alex.
Oh, I was just saying, Judy noted a lot, but do you have additional comments, or?
Go, Ramona, you go ahead. That's all right.
Well, I was going to say that there, as Rick pointed out, you can't get to zero risk of re-identification, particularly within rare disease patients. But it's probably known to most people on this call that rare disease patients are generally want their data to be shared, are happy with a certain level of risk of re-identification. But we can really provide a solution that keeps everyone happy, in the sense that by having these secure data analysis platforms in Vivli and in RDCA-DAP, even if someone were to be able to re-identify the data are a secure environment, and it's only the results that are being taken out into the world. And so that is further really almost eliminating any risk of re-identification, or of that re-identified data getting out into the public where it could do some potential harm.
Is that, that reminds me, as we were discussing throughout the years, Vivli has been very, very successful. You had tons of industry trial data in the platform. A lot of science has been done. But you were telling me, in rare disease, it's still a little more complicated. Would you see these security concerns, the identification concerns still being the main roadblocks you see in your discussion with industry when it comes to rare disease trial data?
Yeah, I think that's a good question. I mean, a lot of it is due to the size of the trials. That's just gets very difficult if you're trying to, as Rick was talking about, and Ramona, trying to maintain that utility of the data is very hard when you're talking about very small trials for rare diseases. I think that is problematic and potentially therefore more re-identifiable. I think the value of the partnership is that you are a very trusted entity where I think our members feel comfortable, sharing the data, the anonymized data. So Vivli only works in anonymized data, so we don't manage de-identified data. To share that with the critical path team, who can then harmonize, aggregate, and allow for doing the work that Ramona was talking about, even just the male-female example, so that you can get to a greater data set that can lead to more insight than just that one trial. And that, which is, we work on a trial by trial basis. And so it does, that partnership really helps deliver some of that work. I mean, we were actually created, one of the key principles was to break down these silos and these barriers that we're seeing in data sharing. So, this very much works straight to our mission to try to work with Critical Path to get this data out there.
Thanks. And I see a question on potential conflicts, right? Darren is telling us this is great, because it simplifies access for data. It also amplifies access for data, but how do you resolve conflicting terms? Darren is mentioning informed consent. I think for consent, both Vivli and RDCA-DAP, we request on the data sharing for any data set that we get independently of each other, that the contributor for data has the consent to share the data to a platform like RDCA-DAP, and I believe it is the same for Vivli. But maybe Rick and Julie, can you comment on the legal piece and actually how the long-term collaboration between C-Path and Vivli simplified the legal bits when we were working for that collaboration?
You want to go first, Julie?
I'll start and then maybe you can add to it. So Vivli has a standard harmonized data use agreement that we have put in place and it's been in place since the beginning. That harmonized agreement is by all 55 all members, have a harmonized process that they agree to. When RDCA-DAP was being formed, we kind of worked together and had many discussions about trying to harmonize our agreements across the two platforms, just to try to make that sharing easier and more straightforward. But it is up to the member, our Vivli members, to decide their basis for being able to share the data. So it's their decision about informed consent and whatnot. As Rick kind of alluded to, GDPR doesn't apply to anonymized data and some of those other issues. Many people it's the belief and the kind of position that once your data is anonymized, it's no longer human subjects data. So different kind of rules apply in terms of informed consent. But you have to form your legal basis for sharing. Now, I say all this, I am not a lawyer, but that is kind of the layman's understanding of it. So Rick, where you?
and I'll make the same stipulation. I'm not a lawyer either, but yeah, I think the big hurdle we overcame was to harmonize the data use agreement. The other big portion and the other main factor with data sharing through RDCA-DAP and I'm sure through Vivli too is the data contribution agreement when the data comes in. And so we have a legal framework around every contribution of data to any data platform within C-Path that makes sure that we've got very clear understanding with the contributor about how the data can be used, whether the data is fully anonymized or pseudonymized under GDPR. And then if it's pseudonymized, we have to make sure we're adhering to the standard contractual clauses, that we can have a process for notifications and all that falls under the GDPR regulations. But then we also make sure, similar to what Julie said, that the data contributor has the ability to review any access requests for their data, and they can make the call on whether it either adds risk of re-identification or doesn't adhere to their policies around the use of their data. So we put a lot of the decision-making control of the data in the hands of the contributor to make sure that they feel they understand how their data is being used and have confidence that it's not being misused.
Thanks both. And I mean, to me, it's that was really a key part that played a role in finalizing the current agreement that we have been discussing for a long time. Vivli shared with us some of your contribution and data use agreement, and we knew the language, and as we built our own language, there was a lot of alignment that we built in that really facilitated that. We also have a bridge with the Node.im Rare platform with an activator with a programming interface for exchange of data. That has been a lot of work. You know, when we started with Nord, they are collaborators, so the discussions were easy in the sense that we were collaborators to begin with, but we had to do a lot of this, you know, redlining and legal discussions to reach, you know, to finalize the agreements to allow that API to be in place and the data that they collect to flow into the RDCA-DAP platform. So it is definitely an effort on the legal end to reach that alignment. I think that it's a thin balance on the language, on the data use and data contribution agreement, on especially on the data use agreement, to be flexible enough, but also broad enough and not have too many specifics. And, you know, it's the way we work is really to maximize data sharing. We also have to provide the flexibility for the contributors because different stakeholders have different requirements. So it's, you know, it's still a lot of work. I do think that at RDCA-DAP, we've been working with kind of the same template now for a while after many conversations and iterations. Julie, I don't know if you're still making adjustment or if you've been put on your agreement for a long time now.
We've very rarely updated it, but there have been some updates over the years in the last 6 years.
Okay. I have a question from the audience on ultra rare disease patient data, and is that something we can work on at RDCA-DAP and Vivli? So,
I would say, you know, that all of the technical, social anonymization, privacy concerns and challenges and solutions that we talked about for rare diseases absolutely apply to ultra rare diseases. And in fact, are probably even more important there. But I guess I have a question for Julie and Alex. Have you actually have companies or patient organizations or academics actually been willing to share ultra rare disease data on either of the platforms up to this point?
Alex, do you want to go first or?
yeah, I can go first. I mean, on my end, no.
That was my impression. That's why I wanted
yes.
to
I'm trying to remember because I mean it's not like it never came up that I never had discussions in ultra disease and discussions, but it never led to a data sharing. So I mean, especially when we were talking single patients to under 10, you know, under risk of free identification, just kind of brings in more conversation on getting the patient's authorization to share everything about them, which I do believe, you know, in ultra rare, like some patients are willing to do that, but we never really had that use case. Never happened.
Alex, the one case, it's not under RDCA-DAP, but under another C-Path consortium, we did have a mandate. I don't know that it was ultra rare, but it was rare enough. It was a small enough trial that the contributor was concerned about, you know, the small data set or the small limited number of patients and the risk of re-identification. So the mandate was we had to create a aggregated data set and they had a specific requirement for how many patients before they would allow their data to be shared as part of an aggregated data set with the study IDs de-identified. So we have done special cases like that where we don't allow the individual data set to be used, but we only allow it to be used as part of an aggregate that met some certain criteria.
Yeah, I mean, I can't think of an occasion where we have had that. There certainly could be on Vivli, just the volume that we have. I think we're open. We would certainly, I'd be open to that. I'd love to see the partnership advance in that way. This is where I would love to see patient advocacy groups kind of really push and advocate for their data to be used, for the data to be unlocked so that it could be shared with because sometimes the patient groups maybe don't own that data, but something that they would kind of desire and say that this needs to happen for our community. And I'd love to see examples where that could move forward.
And that I see that relates to a question that another question someone put in the chat, the Q&A about patients providing their own consent through the platform. I mean, that is something that I hear coming up more and more is this need for platforms to allow patients to come in and manage consent on a case-by-case basis. And so that's something where right now there's still a fair number of technical challenges and legal challenges associated with that, but that's definitely something we're looking into.
Yeah.
Yeah, and one thing to point out is right now we couldn't support that because we C-Path never have the patient ID.
Right,
So
we
we have no way to identify the patient. What we can do is work through the contributor. And we've done that in the past where if somebody does send a request about their data to us, we have to go back to the contributor because we don't have the ability to identify those patients and ask them either whether it's removal or notification or to provide additional consent.
Yeah. But to tie back to the webinar topic, what we can do as well is connect to platforms that do that. So we do have an active collaboration with Global Gene Rare X, and their platform is a platform that allows that patient-owned, patient-reported registry data that is collected on Rare X, and we're discussing how to aggregate Rare X data with RDCA-DAP as a first step of another type of bridge that we can make so that we can pull data together between platforms, increase the amount of information available so that more interesting science can be done out of the pooled data, ultimately to the benefit of patients. So I want to finish with a last question for you, Julie, but Ramona and Rick, if you have anything you want to add, please do. What's next? What's the future of this collaboration? What do you want to see happen for rare disease? Speaking for the perspective of Vivli.
I would love to see more of our members starting to use this process that we've developed to share their rare disease data in this way, to get to the point then that I would love us to see us work together perhaps on a data challenge. So figuring out how to really promote the reuse of this data. And, you know, to my mind, that might be some years away, but I would love to see us really focus on the reuse case of what can be done with this incredibly valuable data, particularly all the work that your team does to harmonize this data and how much easier it is because of, you know, some of the work that is done to really then drive forward those insights and to really kind of move forward and get more science, get more movement forward in this rare disease space.
All right. Anything else, Ramona or Rick?
This is the beginning, right?
Yeah.
I find we've broken a really big barrier here. I don't know if people really
Yeah.
how important this is in terms of being a first step to building this real ecosystem of data sharing. So it's very exciting to think about what's going to come out of it next.
And I would just add, we've kind of focused our attention on making the data easy to find and request. And I think next steps involve making the data easier to analyze across platforms, again, without having to go through the hassle of trying to upload data yourself and things like that. So if we can really achieve some form of federated analysis where data doesn't have to leave the platform at all, I think that's on the horizon.
All right. Let's conclude on that. Thanks everyone for joining the webinar today. Thanks Julie Wood and Vivli for their collaboration and presentation. And thanks Ramona and Rick for helping me with this panel today. I'm gonna close the webinar. We have monthly webinars coming up under the Rare and Orphan Disease Program at C-Path. The next one will be March 20th, and a big update on the critical path for rare neurodegenerative disease that actively works for ALS and other rare neurodegenerative disease, followed in April by a webinar from the Duchenne Consortium. And then in May, we will have colleagues from Nord and my colleagues and Ramona colleagues from the platform team to discuss our active exchange interface and all the lessons learned that are coming out from this exchange that we do of data between IAM-RARE and RDCA-DAP. With that, thanks everyone again for joining and have a wonderful day.
Thank you.
Thank you very much.